Good day, my name is Dennis Williamson, a student nurse at the University of the Bahamas. Today, I will be demonstrating the hair, skin, and nail procedure. But first, wash your hands. So I will be performing the hand washing hygiene. Now that our hand is clean, I'm going to see my patient.
Come in.
Good day, Mr. Alain. My name is Nurse Williamson. Today, we will be performing our hair, skin, and nail assessment. Is that fine?
Yeah.
Good. I have a few questions before we begin. Did you have any past history of skin cancer?
No.
Okay. Did you go tan, bathing, sunbathing?
No.
No. Did you go in the sun?
Yes.
Okay. Do you wear sunscreen?
No.
Okay. It's very important that you wear sunscreen to protect your skin from the sun rays. Is that fine?
Yeah.
Okay. Now we begin. Can you get that for me, please?
So,
Okay. Before we start inspecting, when we start inspecting the body, our skin, we are looking for the paleness, we are looking for discoloration, jaundice, which is yellow, erythema, which is red, and cyanosis, which is blue. So we are going to palpate the skin, the upper extremities. So we feel it for if the body is warm, the temperature of the body. We feel it for moistness or dryness, and his body is dry, which is normal. The temperature is normal, which is warm. We also feel it for the thinness of the skin, and also how smooth is the skin. The only layer of his body that should be thick of skin is his palm and the sole of his feet. So now we are going to move to his face. We assess his face, and his face has no lesion to it, no abnormalities. So now we're going to check the turgor and the mobility of the skin. So we're going to check by the clavicle. The turgor is when you grasp the skin, and the mobility is when you let it go. So it should bounce back to its correct state. So now we are going to assess his chest, his body is symmetrical, and we are going to check the skin as well. There's no lesion. There's no make sure there's no abnormalities. We're going to check for any cuts, anything that's out of the way that is unordinary, and there is none. Can you stand up for me, Mr. Alvin? So now we're going to check. We're going to palpate and inspect his hair and his scalp. His hair is black, so we make sure there's no infestation in his hair behind his ears. His hair is not bald. There's no gap in his hair. My patient is really easier because my patient hair is really is already cut, it's low, so it's easier for me to inspect. There's nothing, there's no dents in his head or nothing. So we are going to check his beard, his facial beard. There's no gapness, no infestation. So we check in. Okay, can you stand up for me, please? Now we are going to check his back. We see that on his upper back, he had some past acne, correct?
yes.
Yes, he has some past acne, and this is the after effect of it on his upper back. And we see a little in the middle of his spinal cord. So we're going to document that. Stand for me, please. Okay, yeah, so now we are going to check his nails. We are checking for the pinkness of the nails. We are making sure that the nail bed are not soft. It should be hard, because we don't look for that. We're looking for the profile of the nail. Make sure it's 160 degrees or less, and if less than that, the next nails. So we're looking for that. The bed, the pinkness of the nails. It's nicely cut, it's trim, it's clean. We also check the toenails as well. We're checking for the same thing, the profile, the bed, make sure it's hard. Okay, make sure it's hard. Okay, can you sit up in this, Mr. Ali? Okay. Okay, now that we are finished with our hair, skin, and nail assessment, the only things that I will need you to do is to wear your sunscreen to protect your skin, drink enough water, efficient water for your skin, and make sure it's rejuvenate. Also, make sure have a complete diet, because complete diet help your skin and your hair to grow and to be its best. So that'll be it. Thank you.